Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today.
Well, thank you for having me on this program.
Okay, Minister, over the weekend, the ministry would have held a vaccination drive-through in Region 3. Can you tell us how that went?
Well, we had a couple of vaccination drives. We had one in Region 3, we had one in Region 2, and over the weekend we also had another one in Region 6. So I would say we had mixed reaction. I guess some people are now learning about the novelty of these drive-throughs. The one in Region 6, we didn't have a lot of people coming forward, but I guess as we work on them, perhaps we'll get more people coming to the drive-throughs. So Region 6 one, I think we need a lot more work on it. Region 2, we had a fairly good turnout, and Region 3, we also had a fairly good turnout. So of the three that was done over the weekend, I think the ones in Region 3 and 2, we were able to get quite a number of people coming to the drive-through.
Okay, Minister, do you have a breakdown of those numbers for us?
I don't have those numbers with me right now.
Okay. Well, speaking of breakdown, can we have an update on the current vaccination numbers?
Well, as of today, we've had 227,690 persons receiving their first dose vaccine. That would amount to about 46.8% of our population. And for second dose, we've had 98,635 persons who are now fully vaccinated. That represents about 20.3% of our population. So we are improving gradually, and and we look forward to those numbers going up during this week. So definitely, we're going to pass 100,000 for the second dose this week.
Minister, I know we are currently in the middle of a natural disaster with flooding, and I know in some regions it has affected vaccination uptake. Can you say how that has been in the regions?
So we've had flooding in a number of places, and the health team, they continue to do their routine work. They continue to do vaccination, and they also continue to monitor for waterborne diseases. So that's an ongoing process. In terms of waterborne diseases, we have not seen much cases as yet, but we keep monitoring, and we have been doing prophylaxis, giving people ORS or rehydration salts, explaining to them how to make the water safe, either by using bleach or boiling. Um, so I think that has had an effect on how people consume water and other things. We have also been explaining to them about skin rashes and what they can do to prevent skin rashes. And we have also been looking at mosquito-borne diseases. So one of the measures that we have put several measures in place. So our team from Ministry of Health has been on the ground in most of these flooded areas, spoken to residents, did outreach clinics in most of these areas, given out medication and so forth. So we continue to do that. We have also partnered with the CDC, and we have done special kits where there's a medical package now that CDC is giving out that would have some basic things like oral rehydration salts, bleach, some ointments that you can use. These are all over the counter medication that you can use. And so, as they go out to distribute hampers to flooded areas, inclusive in that hamper is a medical package that can be used, and there's also instructions that goes with that package. So we have done that across the country. In addition to that, we have noticed one or two areas where there've been um, mosquito-borne diseases. So, like in the upper and middle Mazaruni, we have had some cases there, um, more than usual. So, we had sent in a team last week, and we have also distributed insecticide impregnated bed nets. We also have a strong campaign using these nets in Region 1, Region 7, Region 9, and of course in Region 8. But this particular area in Mazaruni in Region 7, after we noticed a spike, we made sure that they got nets. We have also seen a couple of cases of dengue in Region 6 in Blackbush Boulder. We've had, to be specific, we've had 3 cases. And so our medical team has been monitoring what's going on there. We haven't had, for the past week, any additional cases, but we have taken the extra precaution of giving them, the residents in that particular area, about 300 insecticide impregnated bed nets. And some of the other flooded areas in Region 6, we have also given them some bed nets. So this is an ongoing process of monitoring, and we'll continue to do so.
Sir, in addition to all that has been done for flooding, the medical team on the ground, are they still doing vaccination when they go into these areas? Because I know you had mentioned that they were doing some as well.
We do offer vaccination, and again, all the regions we are working in, and we are providing vaccines to make sure that we can give both first and second doses.
Okay, Minister. Okay. How are we doing in terms of our testing capacity, both central and regionally for COVID-19?
So we test now with 3 different types of tests, if you like. So we do PCR. Those have to be collected and sent to the National Reference Lab, and we have increased the capacity there. So we have capacity to do approximately 2,000 tests. We don't get as much sample. On average, we get maybe 300 to 400 samples a day, and so we are able to run those tests quite comfortably, and people more or less would get back their results within a 24-hour period. In addition to that, there's a different type of PCR, which is point of care PCR, where we use gene expert machines, and we have been using some specialized cartridges to do COVID-19 tests. We have these machines at some of the regional hospitals, like in Region 1 and 9. And so they, on their own, once they collect the sample, can run these samples locally with their gene expert machines. We have, in addition to that, we have added a gene expert machine at the COVID hospital for purposes of reducing people who might be in transition or who would have an indeterminate status and would have to wait some period of time to be able to get those results. So we have placed that additional machine at the Georgetown Hospital. And if there's a need to have a PCR confirmation using the gene export, that can be done almost immediately. So we have reduced the waiting time for inpatient persons who are in the hospital, and we need to know their status. And that has helped to improve patient care tremendously. So that process has started probably about a month ago, and we have seen a decline in the number of patients who would have been suspected with COVID, but we didn't know what exactly was the status. So this has been very helpful. In addition to the gene export, we also have antigen testing, and almost every region would have received antigen test kits, so they can use them when the person meet the criteria. We have found with our test kits, the antigen test kits, that if people are asymptomatic or then you don't really get a positive result. So you can be negative on the antigen test kit, but come back positive on the PCR. And that depends on the sensitivity of the test. So, but if you're symptomatic, if you're having some fevers or chills or whatever, or breathing problems, very often there's a good correlation between positive test results and those symptoms. So, the technical staff have been using the antigen test kits mostly when they have patients that exhibit some um, symptoms, just to confirm or to reject whether that person is COVID positive or not. So, but all the regions they have test kits and they've been using them.
Okay, Minister. Before we go, I have to ask: are we monitoring any specific area that's a current hotspot?
We monitor everywhere in Guyana, but we have noticed a trend over the last week or two where there's been increase in Region 9. So we've had more cases in Sand Creek. We've had cases in St. Ignatius. We've had some increase in cases in and around Latem. But we continue to monitor, and of course, our medical teams are going into these areas. We have also seen over the last couple of weeks an increase in cases in Region 10, um, and in specific areas in Region 10, we have noticed that those cases have been going up. And of course, we have seen, in addition to cases, we have seen an increase in hospitalization in Region 10. We've had consistently patients coming into the Linden Hospital. So that's something that we keep monitoring. And we've had a few deaths there as well.
Okay, Minister, thank you for that, and thank you so much for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy and our social media platforms.